tells, and they say health is wealth. When your body is well, your pocket economically also will be well, because if you're not fine, it will drain you to spend on medical bills. Yet today we have another exciting topic regarding hearing loss or ear infections. We are going to see which things you could be doing in the community which could have put you at a risk of getting an ear infection, and which on the long-term results could lead you to get maybe a complete hearing dysfunction, like you can't get what people are saying very well. With us today, we are privileged once again to have a guest who will introduce himself, then we shall pick on from there. You're most welcome to the DAKTARI show. Sir, you can introduce yourself to the viewers.
Good morning, our dear viewers. Thank you for streaming. My name is Nsamba John Baptist. I'm a nurse by profession. Thank you.
All right. Thank you very much, Mr. John. And also our viewers, we are going to start this journey together. Let's pick on, be attentive and note, because it's going to be a life-changing goal for us. Mr. John, let's speak on. Today's topic is regarding hearing loss and ear infections. A viewer outside may not know what is hearing loss and these ear infections.
To start with hearing loss and ear infections, before we talk about what is ear infections or hearing loss is, it's better to first understand your brief anatomy of the ear to better understand this topic. Whereby when we look at our ear, it is made up of three parts, or it is divided into three parts, where we have the external ear. And the external ear, it is this spinner which you are seeing outside, which collects sound waves, and it takes them to the external auditory canal, which conveys them to the eardrum, where therefore the external part or the external ear is made up of the pinna and the external auditory canal. Then after the external ear, we go to what we call the middle ear, which is a six-sided ear filled cavity, whereby it is made up of the middle ear cleft, which is made up of the the oscular system, which is made up of the malleus, the incus, and the steps, those three bones. It is also made up of the Eustachian tube. It is also made up of the mastoid ear cells, the auditus, and the antrum, whereby this middle ear cleft is made up of the floor, the roof, the anterior wall, the posterior wall, and the middle wall, whereby it is also divided into three divisions, where we have the epitympanum, the mesotympanum, and the hypotympanum, whereby after this external ear conveying the sound waves to the tympanic membrane, now these bones within the middle ear vibrates and they transmit the sound vibrations to now the inner ear, whereby the inner ear, as you see it in that image, it is made up of the bone part, which is the outer, which is called the bone lamellith, which is made up of the vestibule, the cochlea, and the semicircular canal, whereby this one encloses a fluid which you call perine fluid, which surrounds the external surface of the another part, which is called the membranous labyrinth, which is mainly responsible for balance as the balance center, where it is made up of the semicircular ducts, the cochlear duct, the utricle, and the sacculi. In brief, that is the brief anatomy of the ear. Therefore, to define the ear infections and the hearing loss, for ear infections, this is when pathogens invade the ear and they cause inflammation, hence infecting that ear. And this infection can be within the external ear, and we shall call it otitis externa if it is the external ear which is affected, or it can be in the middle ear, and if the infection is within the middle ear, we shall call it otitis media, and when the infection is within the inner ear, we shall call it labyrinthitis. Then for hearing loss, this is the partial or complete inability to hear sound waves, and this can be due to damage of the ear structures or the auditory pathway. Hence, the hearing loss can also further be divided into two: the conductive hearing loss and the sensorineural hearing loss, whereby conductive hearing loss, this is where the external or middle ear is damaged. The structures of the external or middle ear are damaged. There will be no conduction of sound waves to the inner ear. Or it can be sensory neural hearing loss, when there is damage of the inner ear or the auditory pathway, mainly the auditory nerve. There we shall get sensory neural hearing loss.
All right, thank you very much, Mr. John. Hope our dear viewers have gotten to note that this hearing loss, it can be you classified into two: conductive or sensorineural, where like the nerves have gotten maybe some dysfunction. So now our viewers have gotten to know what these ear infections are. You have told us when it's in the outer ear, middle ear, and even when it's in the inner, middle, and outside ear. So a viewer outside may be wondering, which things could they be doing which could put them at risk of getting these ear infections, or things which also can predispose them to get hearing loss?
Among the risk factors of hearing loss, when it comes to the external ear otitis externa, mainly we talk about water exposure. Those who are exposed to dirty water, mainly those who swim in dirty water, skin infections, or even the ear traumas can cause otitis externa. Then when it comes to otitis media, among the risk factors, we have the respiratory infections. Those who don't want to go and treat respiratory infections, you can easily get the otitis media. Sorry
to cut you short. Which are some of those examples of the respiratory infections?
Respiratory infections, as you hear, it is an infection of the respiratory system, whereby pathogen, any pathogen, maybe I can talk about those pathogens which can cause these infections, but still they can be bacteria, virus, they can be fungi. Any respiratory infection, so long as it crosses the eustachian tube and goes to the middle ear, can result into otitis media. There are 4 respiratory infections, like those pneumonias, those croups, those epiglottitis. They can all cause these middle ear infections.
So meaning there is a connection between the ears and the respiratory system?
Yeah.
Okay.
Of course there is a connection. When you look at the anatomy of the of the ear, I've talked about the eustachian tube. We shall find that this eustachian tube has 2 openings, which is the one which is in the in the middle ear, and it goes and opens into the into the respiratory system, whereby you will find the role of this eustachian tube is to maintain pressure within within the middle ear cavity, whereby you'll find in situations where this eustachian tube is having any blockage, it will cause to the lowering of the pressure within the middle ear cavity or the tympanic cavity, resulting into entry of fluids into this cavity, which is which we call otitis effusion, whereby in case there is any respiratory infection, in case that infection passes through the eustachian tube and it enters the middle ear or the tympanic cavity, when there is those fluids, this pathogen will now cause an infection, whereby there will be pus formation. These microorganisms like the bacteria, they will release enzymes which will cause like perforations of the tympanic membrane, bulging, even discharges. They will start seeing discharges from the what? From the ear. That is how briefly I can bring it out, the anatomy of the middle ear and the respiratory system is connected. It's all about the Eustachian tube. Then I was talking about the risk factors in the middle ear. Still we have allergies when there is infection of those sinuses. Also, some mothers have tendency of bottle feeding babies when they are lying on their backs. It is very bad. Feeding babies while lying on their back, it can also predispose these kids to these respiratory infections, especially the otitis media, which I'm talking about. And then remember, it is the second most common disease of childhood after the upper respiratory infections. Those are some of the risk factors for what? For otitis media. For hearing loss, among the risk factors for hearing loss, we have aging, we have ototoxic drugs, we have genetics, we have noise. Being in very noisy areas can predispose you to hearing loss, plus the infections of the what? Of the ear. They all predispose you to hearing loss. And to talk about the real causes for the infections, as it was pathogens, whereby among the pathogens we have the bacteria, and the major bacteria which can cause the external ear infection. We have the Streptococcal aureus, and we also have the Pseudomonas aeruginosa, which causes what we call the swimmer's ear, the one which is in dirty water. It could those two are the ones which mainly cause the otitis externa among bacteria. For otitis media, mainly the Streptococcal pneumoniae, Haemophilus influenza, Pteria catarrhis, the Moxilla catarrhis, which is common in children. Then among the viruses, the rhinoviruses, adenoviruses. Among the fungi, we also have the Aspergillus, the Candidiasis, the Candida species can also cause these ear infections.
Okay. All right. Thank you very much, Mr. John. Hope our viewers have gotten to note things you could be doing in the communities which could put you at a risk of getting these ear infections. Key to note, especially for our breastfeeding mothers, people here, whenever they're breastfeeding their children, they do it anyhow. I think in the preventive measures, you give us the recommended position, maybe how these mothers could breastfeed their children in order to prevent the exposure of these children, or putting these children at risk of developing these ear infections or hearing loss, because it's absurd or worrying in case you have a child, the child is born very well, then maybe the child is at the age of 3 or 4 and this child can't hear. So maybe, Mr. John, to ask, in case, what are some of the signs and symptoms for one to know either they have an ear infection or hearing loss, such that they can, our viewers outside there can pick keen interest in case they have any of these, they can go out and seek approved or medical specialized care.
Thank you. Among the signs and symptoms for the otitis externa, there will mainly get itching, you will see swelling, you will have pain. For the otitis media, there we mainly have fever, high-grade fever. You have dullness, congestion of the ear, hearing loss. You will have discharges, pus discharge, the otorrhea, and you will also have irritability, or that itching can also still be there. in babies they will have that severe crying. Those are some of the signs and symptoms. For even you can get perforations. Among the signs, you can see that that tympanic membrane when it is perforated, or bulging when it is red. Yeah, those are some of the signs and the symptoms for otitis media. Then in labyrinthitis, when the inner ear is the one which is affected, we mainly get dizziness, we get vertigo, that spinning sensation. You see as if the world is rotating, or you yourself you are rotating around. Then there is also hearing loss.
Okay.
Then for the hearing loss, what will be the signs and symptoms of hearing loss? Of course, you have problems with the communication. You always raise volumes when you are listening, like maybe music, telling your colleagues stories repeat themselves when you're communicating. Yeah, it is all about problems with the communication related to sound waves.
Okay. Yeah. All right. Thank you very much, Mr. John. And also the viewers outside there, this is key information for you to take note of, because it's going to help you out, because these are the things we could need to do in the communities or avoid, such that we can't get these ear infections. Also, maybe to ask, maybe I don't know if I skipped it out, we have seen often people in the communities cleaning their ears with, maybe, let me say, these cleaners which are like toothpick like. How is that practice advisable?
I think of course it is not advised. Actually, you are not supposed to put any object within your ear. Let it be cotton, let it those cleaning pins which I saw around. You are not allowed to put anything into your ear trying to remove anything. Even if you are bathing, you are not supposed to force water to enter there. The ear, these ears have their natural mechanism of cleaning themselves. Therefore, don't put there anything.
Okay.
Yeah.
All right. Thank you, Mr. John. Then also I had another question. Often you have told us these skin infections are, ear infections are a result maybe of bacteria, also maybe the hearing loss. Some people we have seen in the community, they have a lot of wax in the ears. Could this wax also be a factor, a leading factor which could lead to hearing loss?
Actually, we didn't talk about the causes of hearing loss, but among them it is wax build up. For the conductive hearing loss, it is wax build up within the ear can cause hearing loss, which is conductive.
Okay. Then is this wax accumulation natural, or maybe there are some things a viewer could do which could like lead it to its overproduction?
Okay. This wax production is natural actually, as the ear is trying to clean itself. There is always wax production. However, there are situations where this wax production can be too much in cases of like allergies, or when there is some irritant which is there. Those abnormal practices, you are using drugs without a rationale, self-prescription, then you can also stimulate the production of this wax in excess.
Okay. All right. Thank you very much, Mr. John. And also the viewers of SNL TV, hope you're taking keen note of the things you are supposed to do and which you are not supposed to do. Then regarding these signs and symptoms you have taken us through, you have told us these people often present maybe with, let me say, discharges in case maybe it's an infection from the ear, maybe there is reduced hearing. Which are there some home remedies these people could do before they seek medical attention in the facilities, or immediately they get these signs and symptoms they have to rush to the hospital for specialized management?
Of course, there are some few home remedies they can do. However, the best advice is to immediately go to to the nearby licensed health facility for medical assessment. But what you can do is like preventing this condition from becoming worse. Like in case of otitis externa, you should keep your ear clean, dry. You should not put any object, as we discussed. For otitis media, there is always a lot of pain. You can use warm compressions. You compress the outer ear. In that act, you will try to relieve pain. Also, being well hydrated, take enough fluids. For hearing loss, you avoid noisy areas. Still, you immediately go for medical attention for further assessment and management.
Okay. All right. Thank you very much, Mr. John. As we're almost coming to the closure of our first segment, I want you to clear this question before we go for the break. You have told us the home remedies, maybe which things people could do, like leave the ears dry, maybe do the warm compress where they can put some sponge on the ears. We have seen also people in the community get cooking oil, pour it in the ears. Is that practice also advisable, or it's also contrary, not advisable?
Okay, about that cooking oil, yes, in case you have a lot of wax, you can use it, but you have to know how to use it. Remember, among the home remedies, you should also keep a good hygiene of your ears. It is better to know how to use that cooking oil. Yes, it is fine to use it, cooking oil or olive oil, but you have to know how to use it, how frequent to use it, not using it every day. Whereby it is advisable to use it like every after 3 months. And also when you are using that cooking oil, it's better you first boil that cooking oil, then you leave it to cool. Then when it is just lukewarm, you can now use it. You put like 3 drops, you tilt the head for like 5 minutes, then you turn. You also put 3 drops in the other ear. You also leave it when it is tilted for like 5 minutes. Yeah, that one, it can work, it is good, but the thing is knowing how to use it and how frequent to use it, not using it any excess or any non-hygienic way.
Okay, all right. Thank you very much, Mr. John, and also our viewers. Thank you very much, those who have been with us from the start of the hour of 11 a.m. And today we are discussing, our topic of discussion is regarding ear infections and hearing loss, where Mr. John has, in this first segment, took us through what these are, what is hearing loss, what are these ear infections. He took us through the things you could be doing at home to put at risk of getting these ear infections, and also further took us through the signs and symptoms. How could you know that you have these hearing infections? And then also he concluded it with giving us the home remedies, which things you could do in the home, maybe when you have identified any of those signs and symptoms. And in the next segment is going to take us through what they always do in the hospital, the diagnosis, to confirm these confirmatory tests to know whether you have gotten an ear infection or whether you have gotten a hearing loss dysfunction. And also you give us the preventive measures, because this will be our package that's take home in order to keep ourselves safe from getting any of these hearing dysfunctions and ear infections. Let's get back. Thank you.
West Nile TV, lighting up the region.
Bellingham, Vinicius Jr., Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, the team of dreams!
Catch all 380 games live and in HD on Sports Premium, Channel 259 and Channel 246. Starting this August 15th. Subscribe to Star Times Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. Star Times Football and limited passion.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial break. It's still the Daktari Show, and it's a health educative program which airs here on West Nile TV every Thursday from the hour of 11 a.m. to noon. And in the first segment, those who have just joined us, we have a guest called Mr. John, who took us through ear infections and hearing loss, where he took us through the things you could be doing in the community which could put you at risk of getting ear infections. Did you know that poor breastfeeding, like breastfeeding of your child in a poor position, could put that baby at a risk of getting an ear infection? And also, did you know that cleaning your ears with these sticks is also dangerous to yourself? Then also not bathing, because I emphasized bathing, like cleaning the ears, but however in a gentle way. Then maybe Mr. John, before we pick on further to go deep into, what are some, maybe remind the viewers, those who have just joined, what are the other causes of hearing loss?
Thank you, Mr. Tom. Our dear viewers have just joined. We are continuing with our program. And to remind us of the causes of hearing loss, I'll first emphasize smoking as one of the dangers for causing ear infections. That one is very essential, please note it. And the causes of hearing loss, as we saw, we have conductive hearing loss and sensory neural hearing loss. In conductive hearing loss, we talked about waxy build-up perforations of the tympanic membrane, otitis media, when you're having like infusion, when there is dislocation of these bones of the middle ear, or when you're having otosclerosis, when there is a fusion of these bones of the middle ear, when they can't vibrate to transmit sound waves. Then in sensory neuro, it's all about infections of the what? Of the middle ear, sorry, not middle ear, but of the inner ear, which we say that's labyrinthitis, or when there is low or very high perilymph, the fluid which we say that is within the what? The inner ear, or even these viruses like the measles, mumps, rubella, and also trauma, mainly the head injury. Those are some of the causes of what? Of hearing loss.
Okay, all right. Thank you, Mr. John. Still, I roll the ball back to you. We have someone, we assume, we have someone who has gotten these ear infections. This person has gotten those signs and symptoms. They are having a discharge from the ears. Maybe the ears are warm. These people are no longer hearing very well, and they have come to the hospital for specialized management. What are some of the confirmatory tests or diagnoses you guys do in the hospital to confirm that a viewer or maybe that patient has gotten an ear infection or hearing loss dysfunction?
Thank you, Mr. Tom. To diagnose these ear infections and hearing loss, of course, as our usual practice, we start with the history taking. You have to first take your history to better understand your condition based on history. Then we do a physical exam whereby we can do what we call the otoscopy, whereby we use an instrument known as the otoscope to view to see what is happening within the middle ear, whereby we can see those signs of bulging of the tympanic membrane, perforations, redness of the tympanic membrane, fluids within the tympanic cavity. Then we can also collect a sample from the ear and we take for culture. We do culture to identify which microorganism is causing the problem. For the hearing loss, of course, we shall do hearing assessment, whereby we shall start with the screening tests, whereby we mainly have two screening tests, whereby we start with a test known as Rennie's test, whereby here we use an instrument known as the tuning fork, whereby this tuning fork we use it to do Rennie's test, whereby you will get your tuning fork, whereby it will have the forks to your elbow or on a hard surface, and then after you will put that fork in front of the pinna at a distance of like 10 to 13 centimeters, whereby you will tell the client to tell you whether it's able to hear any sound vibrations or not. And if it's able to hear, you will again tell the client when he or she stops hearing those sound vibration, should inform you. Then when she stops, then you will now turn, whereby you will put the base of the fork just behind the ear. There is what we call the mastoid bone, whereby you will put it there and you tell the client to tell you whether it's hearing any sound vibration or not. In this Rennie's test, in a normal ear, we expect the air conduction to be greater than the bone conduction. Air conduction is the one where the patient is able to hear the sound vibration when you've placed the fork in front of the in front of the pinna. And the bone conduction is where when you've placed the base of the fork at the mastoid bone. In a normal ear, we don't expect it to have a bone conduction, whereby in case the patient is having any bone conduction, we shall say that the bone conduction is greater than air conduction. Therefore, that ear will be abnormal, be having hearing loss, and we shall say Rennie's test negative. If the patient is not able to hear any sound vibration on bone conduction, then we shall say air conduction is greater than bone conduction, and that ear is normal. Rennie's test will be, we shall say Rennie's test positive. Then in case you get abnormal here on Rennie's test, then we continue to another screening test, which is called Weber's test. In Weber's test here, trying to identify the type of hearing loss, whether sensorineural or conductive, based on lateralization of the sound vibration, whereby you will again smash your tuning fork, and then you will press the base at the at the front bone. Then from there you will tell the client to tell you whether it's able to hear any sound vibration and to which direction or to which ear does those sound vibration lateralize or move to. When the when the sound waves are moving to the ear, which was abnormal on Rennie's test, then we shall say that person is having conductive hearing loss. When in Weber's test we have lateralization of sound waves to the abnormal test in Rennie's test, we shall say that one is conductive hearing loss. But when there is lateralization of the sound waves to the normal ear, which was found normal in the what? In the Rennie's test, then we shall say that person is having sensorineural hearing loss of the abnormal ear on Rennie's test, the ear which was found abnormal on Rennie's test. And if there is mixed lateralization or bilateral lateralization, we shall say that client is having mixed hearing loss. Because in Weber's test we don't expect any conduction, sound conduction. Then after that, now we shall go to the diagnostic test, where we do audiometry using the pure tone audiometry, whereby you'll be having a specific frequency of sound. Then we are now going to determine that what intensity can you hear different or those sound waves, like this intensity is measured in decibels. Then here we are going to grade your hearing loss, whether mild, moderate, severe or profound, whereby if you are able to hear between 15 to 20 decibels, that one is normal, you don't have any hearing loss. But in case you are unable to hear at that level, but you are able to hear between 21 to 40 decibels, then we shall say you are having mild hearing loss. If still a client is unable to hear at that one, then we go to the next, whereby if the client is now able to hear between 41 to 60 decibels, then we shall say that client is having moderate hearing loss. But if the client still can't hear, then we go to the next, whereby if the client is able now to hear between 61 to 80 decibels, then we shall say that client is having severe hearing loss. But if the client still can't hear, then we increase beyond 8, and if the client is able to hear above 80, then we shall say that he is having profound hearing loss. And this one is the diagnostic test. Now we shall diagnose whether you are having sensorineural hearing loss, which is severe or mild, or conductive, which is severe or mild. Those are the tests which we shall do to diagnose hearing loss.
Okay, thank you, Mr. John. Maybe a viewer is asking, what is profound hearing loss?
Profound hearing loss, as I've said, when you are not able to hear any sound wave below 80 decibels, but when you are able to hear above 80 decibels, whereby you are almost completely when you can't hear any sound wave, whereby you have complete or total hearing loss.
So like, meaning these people you test them using sound of different like capacities.
Yeah, of different intensities.
Oh, intensities. Okay. All right. Thank you very much, Mr. John. And also our viewers outside there, you have gotten to know on how these people in the hospitals get to know which type of hearing loss or ear infection do you have. Then maybe to ask, in case it's an ear infection, maybe as a result of bacteria, are there tests also you do to confirm?
Yeah, as I said earlier, that we do culture, whereby we do culture sensitivity. We shall take a sample from the affected ear, then we take that sample to the lab and do culture, whereby from there we can do we can identify which pathogen or microorganism that is present.
Okay. Then suppose we assume you have gotten someone, they have gotten all those signs and symptoms. What are the management or hospital management, you always give these people, in case it's an ear infection, maybe as a result of bacteria, or they have a hearing loss as a result of wax accumulation. What intervention or what things do you do in order to relieve these patients to improve their health?
Okay, thank you. In hospital, of course, the management will depend on the severity of the condition. Like in case when you're having palsy build up, we can do a procedure which is known as oral toileting, whereby we sanction that palsy using suctioning machine. Then remember, among the goals when you are managing those infections, we want to cure the disease, relieve you from pain and other symptoms, and prevent complications. Those are some of the goals. Then again, we shall give you drugs to treat the infection, whereby in mild cases, like in acute conditions, we mainly prefer penicillin drugs, whereby like the amoxicillin, which is preferred. For those who are reactive to penicillin, we can use macrolides like the azithromycin, clarithromycin, erythromycin, and in severe conditions like in chronic suppurative otitis media, where you have you've even lost the membrane, the tympanic membrane, when it has lost its intactness, whereby here we shall give like drugs like ciprofloxacin. We can give ear drops or tablets, those antibiotics in simple terms, to manage the condition. If it's a fungal infection, of course, antifungals will be given, like the fluconazole. Then in case of viral infections, of course, here we rarely use drugs, but we use supportive management like hydration. Then we can also manage pain using analgesics like ibuprofen, paracetamol, even the itching, we can manage it using those anti-inflammatory drugs. Then still we can go for surgical measures. When the situation is severe, you can go for surgery, like in cases of when there is need of to reconstruct the tympanic membrane, you can undergo tympanoplasty to reconstruct the tympanic membrane. For the hearing loss, of course, we shall first identify the cause. If the cause is wax build-up, we can do ear syringing, whereby we use warm just fluid, warm water, using a syringe to remove that wax. In case you need hearing aids, depending on the severity of the condition, you can be given hearing aids like the cochlear implants to enable you increase your ability.
Still on those hearing aids, we have seen like in movies, especially among these white countries. Are they also common here in the African countries?
For African countries, to be sincere, I also see them in movies. I can't say that I've ever seen anyone having it in Uganda. I've never seen anyone, but they are there.
All right.
Yeah.
So like they can assist someone to hear very well.
Yes. For management, simply for management, that is all about management. Those antibiotics, analgesics, even surgical procedures in case it is necessary, depending on the severity of the condition.
Okay. So now, regarding maybe someone is reluctant and they have not come for these approved management procedures, and are there some complications these people can develop?
Yeah. Of course, complications are there. When we start with the ear infections, especially the one which is for the otitis externa, that one has few complications, whereby the main complication is hearing loss. When it comes to otitis media, that one can progress from the congestion state, exhaustion state, then it goes to suppurative stage, whereby here you get chronic suppurative otitis media when there is loss of the of the tympanic membrane, when it is no longer intact, whereby you can get complications, whereby you can get mastoiditis, whereby that mastoid bone will get inflamed, the mastoid hair cells will get inflamed and infected. Then you can get petrositis, whereby the petrous bone can be affected. You can get the facial paralysis, that facial nerve can be compressed or infected. Then you can get the facial paralysis. You can also get cranial complications, like the subdural abscess, brain abscess, meningitis, epidural abscess, the lateral sinus thrombosis, and so many others. For hearing loss, the complications, of course, it will be communication, whereby you are unable to communicate effectively, and this one will result into social isolation because you can't communicate. Depression, those can be some of the complications for hearing loss.
All right, thank you very much, Mr. John. Then maybe there's one thing I'd like you to clarify regarding this wax accumulation. Which procedures do you always do?
For wax accumulation, when they are removing wax, they do what I said here, syringing.
Okay.
Yeah, it is the one which is done to remove that wax.
Okay, could you like try to describe for us how it's done?
Of course, as here the term here, syringing, whereby that special syringe, whereby we get warm water. You use that syringe, then you have to do what? You have now, after getting that syringe, it will have the the soft the soft point at the which will be fixed into the ear. Then after you will now flush. It is like a flushing the ear, whereby you will now push that warm water into the ear, then it will come out with with that wax.
Okay. All right, thank you very much, Mr. John. Hope our viewers, you have gotten to know the complications you could get in case you are reluctant to manage your ear infections, as it could lead to permanent hair loss. Then he has told us of the procedures often they do in the hospitals in order to confirm, in order maybe to manage you in case you have gotten any ear dysfunction, infection, or hearing loss. Then maybe, Mr. John, a special package to the viewers of West Nile TV. What are the ways they could do in order to prevent or reduce these ear infections in their homes, and also the ways in order like the hearing loss to be like reduced and prevented?
Among other preventive measures for the ear infections, you need to maintain good hygiene and nutrition, of course. You need to avoid swimming in that water like we saw in the otitis externa. You have to avoid swimming in that water. You have to avoid cigarette exposure and the air pollutants. We talked about allergies causing these ear infections. You have to also go for vaccination. Mothers, not even mothers, only parents, including fathers, you should always take your babies for immunization to get immunized against some of these infections, those respiratory infections which can cause ear infections. Hearing loss, you avoid noisy places, good hygiene still. avoid putting objects within your ears, such measures as we talked about in home remedies.
Okay.
Yeah, those are some of the preventive measures we can do.
All right, thank you very much, Mr. John. And also our viewers have gotten to know of the things you could do in order to reduce the infection rate of ear infections in your homes, and also maybe to safeguard your children, especially breastfeeding mothers. Do what he has told us, proper positioning of your baby when you are breastfeeding. Maybe, Mr. John, is there a special package you feel like the viewers of National TV should get, as we're almost coming to the closure of the program?
The package I can give the West Nile viewers is to take note of these symptoms and their causes, and in case of any abnormal sensation within your ear, please immediately rush to the hospital. As we all know, as we are aging, we depend more on our ears than we depend on any other body part, including the eyes, cause the ear, as we've said, two major functions, the hearing and the balance. That means if your ear is if your ears are no longer functioning, you are likely to even lose balance. Therefore, always seek for medical attention in case of any ear problem from qualified medical personnel. Don't just go to anyone. Don't prescribe anything for yourself. Avoid traditional medical use of those natural herbs. Yes, some are good, but not always. Thank you, our dear viewers.
Okay, thank you very much, Mr. John, and also the viewer of West Nile TV who was with us from the hour of 11 and almost as we're coming to the closure of the program. Me, what I noted most from this conversation, I just know the ear is used for hearing only. I didn't know the ear also is responsible for body balance. So our viewers, take proper care of your ears. In case you have a dysfunction in the ear, you lose your balance in your balance as maybe regarding movement, so you could be at risk of getting these dizziness episodes. So key to note, we have to be hygienic in whatever we are doing, and our ears have to be safe, not also to use these sticks whenever we are cleaning our ears. It has been a great honor to have you, Mr. John, on the Daktari Show, and also our esteemed viewers who are with us. It has been an honor. I've been your host, Sunday Junior Tom, for the Daktari program with Sophie behind the camera. Thank you very much. Have a blessed day.